Hello, my name is Alexandra Sohn, and my presentation is on dissociative identity disorder. Dissociative identity disorder, also referred to as DID, is categorized under the dissociative disorders in the DSM-5, and it was previously in the past referred to as multiple personality disorder. A dissociative disorder is characterized by problems with memory, identity, emotion, perception, behaviors, and a sense of self. DID is described as a disruption of identity characterized by two or more distinct personality states or an experience of possession. Although multiple personalities, known as alters, can exist in a person with this disorder, only one is manifested at a time, and each altered has developed their own memories, behaviors, and life preferences in the way they conduct themselves around others. At least two of these identities take control of a person's behavior and presentation of self at any given time. However, the DSM-5 makes it very clear that it is critical that these observed disturbances in identities and switches between alters are not due to being under the influence of any kind of substance such as drugs or alcohol. There's a well-known author on the subject, last name Carlson, and he wrote an article in 1981 about the history of this disorder in the United States, which is often referred to by other researchers as the basis of their study, and it's where I got a lot of the basic information about this disorder for this project. For decades, there has been disagreement among psychologists about the diagnosis of DID because there are so many ambiguous presentations and symptoms that can often be mislabeled from other disorders. Many of the symptoms experienced by patients who suffer from DID resemble other illnesses such as post-traumatic stress disorder, some seizure disorders, and even substance abuse. However, almost all patients diagnosed with DID suffer from symptoms of memory trouble, such as loss of time, and have hallucinations, feelings of detachment, and changes in presentation of the way they conduct themselves. Folks with DID routinely struggle in memory with remembering periods of time day to day, as well as events from childhood having large gaps in memory and reporting losses of time pretty routinely. They also experience hallucinations of voices and thoughts that seem to not be their own, often stemming from these alters or transitions of identity. The switch in alters throughout periods of time can also result in symptoms of the individual feeling dissociated from their own thoughts as well as the world around them, leading them to detach from reality in many cases. The last common symptom is variable presentation of self, which can come from the differences in appearance, facial expressions, voices, and even different handwritings that occur when a person switches between identities with their disorder. This is because each identity that a person develops has its own preferences for the way that it interacts with others and presents itself to the world. And often these different identities can have various ages, roles to the individual, and interests that set them apart from each of the other identities. There are several approaches to the determination of the cause and development of this ambiguous disorder, but the psychodynamic approach is far and away the most common. There's also extensive research being done currently with cognitive theory. And the development of the psychodynamic perspective is that someone experiences dissociation as a type of defense mechanism to guard against negative feelings or experiences due to not having other adequate coping skills. So the emotional conflict of trying to avoid suffering through a traumatic event or the consequences in the aftermath of a traumatic event, or being unable to find a way to power through it on their own becomes very overwhelming, and as a result, this person may develop DID, different identities to kind of compartmentalize those feelings and deal with them easier, as if it is not themselves having to deal with the situation. The cognitive approach, however, is that when a person is faced with stressful situations, when they are young, their brain can literally not filter out and filter through all of the feelings associated with the event, and starts to shut down different areas of the prefrontal cortex in order to better siphon through the information and process it in smaller bits. Later, these same areas are triggered or shut down based on a person's reaction to other stimuli that are similar to the initial experience. Proposed treatment from the psychodynamic approach is therapy that involves talking about your disorder and related issues with a mental health professional in order to help understand the cause and the source of this condition, as well as forming new ways to cope with these stressful circumstances and the triggers that can change someone's identity day to day. Over time, this may uncover the original trauma that was experienced and led to the development of this disorder. With the cognitive approach, however, there's an emphasis on connecting the thoughts of a situation to the trigger of switching identities and finding ways to reduce the switching, to reduce switches or to reduce loss of time and loss of gaps in memory and things like that. And at the same time, developing ways of dealing with those emotions without having to switch identities. There's often medication associated with this treatment as well, to deal with overwhelming feelings such as depression and anxiety, and for those, it is prescribed to take antidepressants. I personally believe that psychotherapy is more effective and a better perspective to take when thinking about people dealing with DID because it focuses way more on the individual's experience, which is more than likely the root of the issue, whereas cognitive theories focus more on the science, which is still important, but with so many questions still surrounding the disorder, I think that approach can potentially detach the person further from their thoughts and feelings instead of focusing on slowly uncovering the past and focusing really on the individual and their experiences, and can have a much more positive impact in the long run, in my opinion. For a long time, people have experienced the perception of DID being a fabricated illness, claiming that people experiencing this severe disorder are either possessed or making it up or exaggerating their symptoms. And this has a lot to do with the portrayal of people suffering from this disorder in things like movies, TV shows, books, because they're often written with exaggerated symptoms or exaggerated identities. So it makes people who are skeptics of the disorder already feel justified in viewing these things as a dramatization of the disorder and sometimes even blatantly saying the disorder does not exist at all. These views can create false stereotypes about the disorder as well as those who suffer from it and further alienate those people from society. There's also an issue with misdiagnosis of DID, as it can be difficult to determine what people are suffering from and really varies case to case how intensely and how many of the symptoms that people experience. And often these people are diagnosed with PTSD, and that is it. Many people with DID are first diagnosed with PTSD and then sometimes later found to be diagnosed with DID, and sometimes they're never properly diagnosed at all. So I think it's also an issue that people are not getting properly diagnosed within a reasonable time, and then therefore do not have access to the correct treatment. In order to avoid perpetuating the stigma around this disorder, I think it's very important that we share information of the symptoms and diagnosis of DID so that we can present a more realistic idea of what this disorder is like for the people suffering from it in the media, as well as in the way that we discuss the disorder and the people who suffer from it in public and to each other. A psychologist from MIT, his name is Radin, he wrote an article about this issue as it's the core of his practice to talk about these ethical issues, stating that as a community, we should make a point to address the portrayals of this disorder that are inaccurate and offensive from past representations in media, and make efforts to be more positive and thoughtful in the writing of these characters and the way we speak about them in media moving forward. Given the fact that DID is pretty rare, the research around it is not as extensive as it needs to be. And so information should be continually looked for, research should be continually being done and available to the general public so that we can continue to learn and develop a greater understanding of it, as well as the experience of the people who are living with it today. Thank you for listening. I have my sources listed here, and I will also be emailing the script if I can find how to stop recording. Okay, thank you.